Hello everybody, thanks a lot for joining. In the previous lecture, we talked about anxiety neurosis, people who are stressed all day, waiting for the worst thing to happen. In that case, they fear something bad will happen to someone else. Today, we'll continue talking about anxiety, in this case, about hypochondria and hysteria. Hypochondriac people have a lot of body sensations. They have symptoms exactly the same as people with an organic disease. It is very difficult for doctors to differentiate between people with hypochondria and people with organic diseases. It would help a lot to doctors to have psychoanalytical knowledge, to be able to listen to patients properly, so they can or they could identify people suffering from hypochondria. Hypochondria is way more common than you could imagine. It costs millions to the NHS. Of course, if someone goes to the doctor saying they have a lot of physical symptoms, doctors have to do unnecessary tests before they realize they don't have an organic disease. What is the main difference between hypochondria and people with an organic disease? In both cases, patients have physical symptoms, and in both cases, they complain about them. But the results of the medical test of hypochondriac people come back normal. There is no lesion in their bodies. In patients with an organic disease, the disease shows up in the test. There is a lesion in their body. However, having normal test results don't help because they then think doctor didn't do the necessary tests, they don't find what they have, they are not capable enough. This is what we call hypochondriac delirium. They think the sanitary system treats them badly. They tend to have hostile relationships with doctors. They think they know more than them. They are not happy at all. Sometimes it has been said that hypochondria is a congenital disease, something we inherit. What does that mean? In that case, congenital does not refer to our genes. It refers to the sentences we have heard when we were growing up, to the family structure, to the way in which we have been told to think about certain things. This is very visible, for example, in eating disorders. It means that structure facilitates the sentences we have heard and has built the relationship we have with our own body. And guess what? What is the main and most important relationship for hypochondriac people? The relationship with their own body. And that can become a problem. Let's see how and why. Hypochondria is a narcissistic disorder. I'm going to explain you in a simple way, although it's a lot more complex. When Freud talks about narcissism, he says we have a constant energy, the libido. This is our psychic energy. In healthy individuals, that energy is in constant movement. That means that I have that energy in my body, I choose an object, I surround it with my energy, and after that, the energy gets back to me. Let's say I like to do yoga. I put my focus, my attention, my energy in the yoga class, and when the yoga class is over, that energy gets back to me. What happens with hypochondriac people? What happens is that all their energy is put on themselves, in the organ they are worried about. I see this a lot in my practice. Human being is social. That implies that in order to understand what is going on in the life of a person, we need to also take into account the social relationships, or lack of them, of that person. If we keep all energy in ourselves, we get sick. Just like that, we get sick. Freud already said, if we don't love, we get sick. This is the issue with mental health disorders. They affect and impact the whole life of the patient. There is a play by Molière called The Imaginary Invalid that explains very well the life of hypochondriac people. As you can imagine, everything is around how he feels, his symptoms, the look for treatment, how no one takes him seriously and laugh at him. No one knows what happens to me. That will be the sentence of the hypochondriac person. It is very important how narcissistic disorders are linked to selfishness. In what sense? Let's say someone is sick. That person has all its energy focused in the organ, which is diseased. That would make a lot of sense. The person needs to heal. However, in the case of hypochondriac people, they are taking all the energy away from the outside world, keeping it for themselves to cure a disease which does not exist. In reality, hypochondriac people are very isolated from the real world. They can't love, they can't work, they have no interest at all. That ends up sickening the body. It can sicken their whole body. We can observe how losses, breakups, disappointments, we cannot elaborate, can lead to a mental health disorder. We will see this when we talk about depression. In a way, hypochondria is a way to elaborate reality because they can process, elaborate that one day they will die. They die a little bit every day. Hypochondria is a super complex disorder. We won't get into much detail. However, at first sight, you can notice that hypochondriac people are, on the one hand, a bit obsessive. They have that fixed and irrational idea that they have an organic disease, the delirium. On the other hand, they are a bit psychotic because they are talking all the time about their delirium, the organic disease, which does not exist. Traditional medicine, psychiatry, cannot resolve this mental health disorder. Why? Because hypochondria is a type of neurosis with a strong anxiety component. How does traditional medicine and psychiatry treat anxiety? With tranquilizers. Best case scenario, with behavioral therapy. It does not work. I hope you have a glimpse of how complex this disorder is. Psychoanalysis is the most efficient tool, the one which works best. Why? Because what hypochondriac patients need is to elaborate new situations. Sometimes we get sick because we can't accept the reality or because we can't elaborate certain situations. Unconsciously, and this might sound shocking, it is easier to get sick because if I am sick, I don't have a future, so I don't need to worry about it. Instead of building a life, a future, I get sick. Let's leave it here for now and move to another mental health disorder, which is also triggered by anxiety. We will see in our next lecture how hypochondria can lead to psychosomatic disorder. We have seen how our emotions, especially anxiety, can impact our body. Before we move on to the psychosomatic disorder, let's have a look at another mental health disorder that can impact our body and be mistaken with an organic disease, hysteria. Modern society likes the idea that we can think ourselves better. When we are unwell, we tell ourselves that if we adopt a positive mental attitude, we will have a better chance of recovery. I am sure that is correct, but society has not fully woken up to the frequency with which people do the opposite, unconsciously think themselves ill. On any average day, perhaps as many as a third of people who go to see their GPs have symptoms that are deemed medically unexplained. I know hysteria might remind you to the Middle Ages when people were treated with electroshock. But, believe it or not, nowadays hysteria is also trendy. Many of the skin sickness have hysteria as underlying psychic structure. Chronic dermatitis, allergies, they have a clear and strong psychic influence. Even the patients are aware their outbreaks are not random. They happen in vital events that deeply affect them. Students in an exam, entrepreneurs upon an important project, a skin rash isn't random. What Freud discovered with hysteria is that whatever we can process psychically will be processed in our body. This mechanism is called conversion. Let's see this in more depth. Hysteria, as many other mental health disorders, is a position in the language, and as such, something we can change. The main mechanism of hysteria is repression. The only way we have to learn about repression is when it fails. when whatever was repressed comes back in the form of a symptom. How is this process? When a representation is unbearable for the conscience, the representation is repressed, and the affection is derived to the body. Boom, compression. In hysteria, one of the most remarkable aspects is that the affection disappears completely. The unbearable representation is repressed, and the affection is derived by conversion in a somatic innervation, in a symptom. In the case of an stimulus, psychic or somatic, we need to elaborate it psychic and somatically. What fails in hysteria is the elaboration of the psychic stimulus psychically. The main somatic disorders caused by hysteria are hysterical paralysis, paresthesias, hysterical blindness, and hysterical neuralgia. It is very important to remark that these symptoms do not follow the real anatomy. They correspond to an imaginary one, related to the corporal image. The symptom, as we said, is not random. It is related to the story of the patient. Hysterical symptoms affect normally the head, mouth, and the musculoskeletal system. And it does not matter what the patient went through, but what he remembers about it. There is a sentence that determines the symptom. Example, I have a paralysis, so a patient has a paralysis in the legs, and the sentence, which is holding that symptoms, would be, she couldn't go any step further. This is what the patient would say about her paralysis, without realizing. There is a paralysis on the face, and the sentence would be, it felt like he was slapping my face. More and more often, we hear about strange diseases. People suffering from deep chronic pain, like fibromyalgia. MRIs show no lesion in their bodies, but they suffer from deep chronic pain. It is true that fibromyalgia is very complex, and latest findings now show that in some cases it could be related with MCAS, another complex congenital disorder of the immune system, mast cell activation syndrome. However, traditional medicine alone cannot yet explain these disorders. However, thanks to psychoanalysis, we could think that in some cases, the underlying structure could be hysteria, and as such, we could cure it. I hope you are enjoying. This is fascinating. In our next session, we will see how hypochondria, if left untreated, can lead to other more severe mental health disorders, like psychosomatic disorder. I hope you find it useful, and any question, just ask. There is an open community for that. Thank you very much, and see you next time.